This patient has an anterior crossbite with very severe crowding. To set the IPR value, we will proceed with the final setup first. Aligns the rotated teeth. Adjust axis by applying minus torque. Aligns the maxillar. In the maxilla, the lateral incisors are retracted, so we will apply expansion. Straighten the mesial inclined axis by applying minus tip. Check the occlusal interference, overjet amount, and overbite amount. We will apply IPR to the 20th tooth and mandibular anterior region with a lot of overlap. We will perform 0.3 millimeters IPR between number 23 and 24, number 42 and 43, number 43 and 44, number 44 and 45, number 32 and 33, number 33 and 34. Expansion to resolve crowding. Since crowding is severe, we will expand in several stages. Secure space for the lateral incisors by applying plus torque. In layer 2, rotate tooth number 41 while expanding the mandible. While rotating, adjust the axis through the minus tip with the same rotational movement. Adjust expansion and rotation in the maxilla. By using plus torque and intrusion, we prevent occlusal interference that may occur during jumping. In layer 3, we finish the rotation leveling. Layer 3 is the pre-retraction stage, Adjust all teeth are close to the target arch line. Apply more retraction to the mandible to prevent occlusal interference. Control the amount of overjet by applying extrusion and minus torque to tooth number 23. Alignment was not finished, but overlap occurred in the mandible. We need to secure space by applying IPR. In the last layer, we finish the setup with retraction. Be careful with occlusion height and open bite. Divide evenly the amount of overlap using mesial or distal movement. Adjusting the amount of overbite by applying retraction and extrusion in the anterior region. Be careful not to decrease occlusal height by applying extrusion in the mandible. After setup is completed, create steps using the superimpose function. In layer 1, tooth number 11 and 41 are the teeth that have moved the most. Divide the steps based on this. In layer 2, tooth number 12 and 42 are the teeth that have moved the most. Divide the steps based on this. In layer 3, tooth number 11 and 41 are the teeth that have moved the most. Divide the steps based on this. Increase the number of steps to compensate for the large movement of the previous layer. In layer 4, tooth number 13 and 34 are the teeth that have moved the most. Divide the steps based on this. In the last layer, tooth number 11 and 41 are the teeth that have moved the most. Divide the steps based on this. Finally, check the number of aligners through Show All Steps function.